Hello and hi everyone. Today we will learn about the basic phlebotomy technique. The first step is introduction and preparation of ourselves. Introduce ourselves to the patient politely and greet them by saying salam sejahtera or hello and say your name and your purpose. We also need to address our patient accordingly, such as addressing them as Encik, Puan, Cik, Sir, Miss, and anything that makes them comfortable. Next step is patient identification. The patient identification, please ask the patient name and ask if the patient knows the purpose of the test conducted. If they don't, mind to explain briefly about the blood drawing purpose. Note in mind, before drawing the blood, please identify the tube that need to be used based on the request form provided by the doctor. And if more than one test are requested, please follow the order of the draw. And do take note of the invasion time for each of the tube. This is the table show the order of draw for evacuated tube and syringe blood collection. The next is preparation of the equipment. The equipment needed when drawing the blood are tourniquet, alcohol swab, cotton swab, syringe, tube test, and gloves. After all the preparation of equipment complete, as a phlebotomist, we should ask some questions to the patient for the patient risk assessment to avoid patient injury and also future lawsuit. Here are some few questions that can be asked to the patient during the assessment. The first one is, have you taken any medication? The second question, have you ever taken blood? And if yes, do you have any side effect from the previous like fainting, dizziness, and nauseous? And the third one, if you're drawing blood fasting test sample, you can ask the patient like, do you fast yesterday? And many others related questions. This is the important step before the venipuncture begin, which is vein identification. For the vein identification, there are 4 veins that usually used for drawing blood, such as cephalic vein, accessory cephalic vein, median cubital vein, and also basilic vein. Between one of these 4 veins, the preferred one for the venipuncture site is the median cubital vein. Why? Because it has a larger and lower tendency to move or roll when the needle is inserted. Now, we are moving to the venipuncture step. The first step is applying the tourniquet. The tourniquet must be applied around 3 to 4 inches from the venipuncture site. Next, clean the venipuncture site using the alcohol swab to avoid infection and error in the laboratory test result. After that, insert the syringe needle where the bevel side is facing up at angle around 15 to 30 degrees. After the blood flow into the syringe, release the tourniquet, withdraw the syringe needle slowly from the patient's hands, and put the cotton swab to stop the bleeding. After the blood is drawn, check the site of insertion to verify there is no bleeding occur. Then, thank the patient and say something reassuring or encouraging before the patient leaves. Heads up! We are done! But before that, bear in mind, there are also a lot of the improper technique of phlebotomy practice. Some of the improper techniques are, do not apply the syringe before the alcohol swab is dry. Also, avoid touching the venipuncture site after applying the alcohol swab. The next one, do not apply the tourniquet too near or too far above the injection site and do not apply it for more than 1 minute. Do not select the site with IV or mastectomy history. Please anchor the vein properly while taking the blood. Wrong needle insertion angle will contribute to hematoma factor. Also, wrong order of draw and wrong test tube use might result in recollecting the blood from patient. Thank you for watching our video and have a nice day. Bye.